Yesterday, we did a very difficult case, a patient of only 30 who had ruptured his Achilles tendon in 2024. Unfortunately, he underwent a re-rupture following a successful operation. Here in Dubai, we operated with one of the assistants of Julio, who works at HBGMC. We took a tendon from the back of the knee of the same leg that was going to be operated on. It was all done in a minimal invasive fashion. Classically, these operations need an incision of about 20 at times 25 centimeters, really a big gash at the back of the leg. The reason why we don't like this kind of open procedures is that the bigger the incision, the higher the chances of an infection. And an infection at the back of your leg is really big trouble. It is one of the tendons that we routinely use to reconstruct the anterior cruciate ligaments. If footballers can do without one, then it is no wonder that patients who are not engaged in professional sport do extremely well with it. What we did, therefore, we harvested this tendon, which is a long tendon. It is about probably 25, 30 centimeters long, and we used it to bridge the gap between the proximal end and the distal end of the Achilles tendon, all done through, remember, small incisions. The patient was then put in a plaster and was allowed to go home immediately. This is one of the other great advantages of undertaking these procedures in a minimal invasive fashion. Patients are allowed to walk. Yes, they can walk straight away, at least in my hands, with crutches obviously, and being allowed to put their foot on the ground and do exercises with it. It was a great collaboration with the patient and his family. The surgical procedure is just the tip of the iceberg. What really matters is what happened afterwards. And afterwards, the patients will be allowed to not only weight bear and do exercises, but they will be engaged in regular self-administered exercises. After the operation, the best friend becomes the physiotherapist. I become their second best friend and will be monitoring their outcome. All the best.